Well, welcome back, everybody. Good to see you. Hope everybody's enjoyed their day. So we are honored to have our CEO, Safra Catz, with us today, and so please join me in welcoming her to the stage. We spent this morning talking about transformation, right? So a lot of conversation about transformation in healthcare. But you've been at Oracle for over 25 years. Tell us about the transformation that you led inside Oracle.
Well, it's really quite funny because every time I talk to one of you, I end up thinking that so many of the things you're going through are exactly what I went through. Not in medicine, but when Larry first hired me, he said one thing. He said, "We are the largest data management company in the world, and our only actual assets are our people. And at any one time, I have no idea how many I have." And I thought, oh, come on. How hard can this be? And he explained to me that the way Oracle had grown over the years, started in the United States, then the UK, other parts of Europe, Asia, the Middle East, everything, that every single place we thought we were global, but we were actually international, which meant that we were in all these different places. And even though every line of business in every country used Oracle software, they changed it a little in every single place. So we were a giant stovepipe data here, 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 here. And you couldn't just do, as some of you technical folks know, you couldn't just do a giant query and then a join and then dedupe it, because everyone had a different process. And in many of those systems, there were so many duplications that you literally had no idea. The simplest thing in the world, which is how many people work here. Now, that's a simple problem. But in every one of those lines of business, in every country, we also had our own financial systems. So when we would bring those back, once again, it was a massive, massive undertaking. So everything, Larry would say, everything I know about Oracle is not from Oracle systems, but on Yahoo Finance. So, okay? Now, I am sure that none of that is happening for you all. However, the interesting thing was, I think Larry thought when he hired me, we were going to do an IT project. We were going to do an IT transformation. What became very, very clear to me right away was, in fact, that we were doing a business transformation, that we were simplifying our processes, that we were going to be truly global, which is we were going to get from point A to point B this way, not this complicated process we'd used for decades, multiple different ways. But you see, the important thing, though, and we did it all in 1 year. We brought the entire company together into one system, but we did it by simplifying our processes. But in those days, we were about $9 billion in revenue. My first year at Oracle, we saved $1.2 billion. Now, you would think that that's the important number in a story like this. But actually it isn't. The real important number is that year when I came, we were spending $650 million a year on R&D. But R&D was the single most important thing we did, which was to build better products for our customers. Now, we spend over $7 billion. And because of that, because of how we've spent and built our platform over all these years, we could finally come to something Larry talked to me about over 20 years ago, even then, which is to bring healthcare truly into the 21st century, to be able to really benefit not only from better accounting and better HCM and better supply chain, absolutely, and more secure database and economies of scale of the cloud, but to finally bring healthcare and all this technology to finally help our medical professionals save lives. And that's really what the journey has always been about. And you can, I'm sure, look up on YouTube Larry giving a talk many years ago, and you will see him say that if he gets hit by a bus at the Stanford shopping mall, and he can't speak, he's completely knocked out, and they go through his pockets, the only thing they'll know about him, since he doesn't necessarily go to that hospital, is that he's got a charge card and can pay for his visit. And that issue, that problem, has been in his head for decades. And seeing all of you and our announcement today and many more announcements to come, you're going to see this entirely play it out, because we were founded in 1977 as a project, a data project of the Central Intelligence Agency. So you can imagine how security conscious and paranoid we are. And we started way back then thinking about data. And we're finally, with the merger with Cerner and Oracle Health, we are finally bringing it to the single most important thing we can do, and we can do together, is save lives.
Okay, but Safra, bring us back, because I remember when I was in government and we were dealing with the chaos of the COVID pandemic, and we get a call, hey, private sector's calling, Oracle's calling, and they want to help. And tell us about what you did during that time, and then what was sort of the impetus or the turning point to actually thought about healthcare way, way back in the day, but then what was the impetus of actually doing the Cerner acquisition? What drove you to that?
So, of course, all of us, I mean, COVID hit us so hard, hit everyone, hit the whole planet so hard. But for us, coming from the data world, we found it so profoundly disturbing that no one knew anything. And when I say no one knew anything, it's not only that we didn't know what it was or how to cure it or whether we had to leave our mail out in the driveway for 3 days before we opened it or any of that, okay? No, the fact that we didn't even know how many beds were available, which medications. Remember, our poor doctors were experimenting. We were all desperate for different things. But doctors couldn't even share information amongst themselves. This is working. This is not working. Let's not recreate the wheel in every emergency room. And yet, we thought to ourselves, you know what? We already have a cloud. We immediately, with the pharmaceutical companies, all of the clinical trials didn't go at their sites, went right onto our cloud, by the way. Had we not had a cloud, we probably wouldn't have had vaccines so fast, okay? Because you know how long those take. We recruited people into the clinical trials. We built systems that kept track of the different medications that doctors were trying. We did things to help with the supply chain, to be able to find all the different parts. And what we did, by the way, Larry personally ran all those technical projects. But not only that, we realized we had the technology by then. We had the cloud, we had autonomous database, we had the development tools, we had the analytic tools. We built the applications, and we didn't try to sell it to the United States government. We gave it to the United States government.
Free?
And let me just say, I don't think anyone had ever given them anything, because they couldn't even find.
We didn't know what to do.
Seema finally solved it for us on having an agreement where, here, it's free, save America, you know, and we did. Thank you.
Well, you know, one topic that is top of mind for everybody right now is cybersecurity. So in healthcare, we had 2 big recent cyber attacks, and everybody's dealing with concerns about this. What advice do you have for our customers?
Okay. So cybersecurity incidents are almost always human error. I hate to say it, we all love humans, but as you know, humans make mistakes. And I'm not even saying things like they put a sticky note with their password and things like that. They just make even configuration mistakes, setup errors. They literally leave doors open. Because the reality is that any operation that is currently running their own systems also knows that they are connecting in the back with a whole bunch of others. And the way cybersecurity vandals, criminals, bad actors work is often, it's not that they're brilliant. Your system is really a chain with many, many links. And the bad actors are just looking for a weak link. They're just looking for an unpatched system, a misconfiguration, an error. Now, for us at Oracle, security is so ingrained and fundamental. Because I mentioned, our first customer was the CIA. They marvel at how insanely paranoid we are. So when we built our cloud, we built it in a way so that our customers, when their workload is running, our network is running on a completely separate set of processors so that you are never at risk. Customers never at risk from what we call a noisy neighbor or a noisy neighbor. So noisy or nosy. They can't take a free ride. They can't look in. And additionally, we've implemented such deep AI. Again, why? To avoid human error. On the next level is autonomous database. Again, why is it autonomous? Because it is constantly under attack by robots. And humans cannot fight robots. Only robots can fight robots. And again, every single thing we do is focused on security. After one of the hacks, one of the very significant hacks that I know impacted quite a few of you on one of the insurers, they came to our cloud because they realized there was simply no way they could defend themselves against what was going on out there. And it's not only in the healthcare industry, the utility industry, the retail industry, the telcos, and the banks. They've all moved in. Why? because they simply cannot protect themselves. They have to have someone whose whole job is to secure them. Because again, you are at the risk of that one weak link. Unfortunately, if you're not in a secure cloud, they're going to find it, unfortunately.
So you mentioned the cloud,
Yep.
and I've now been at Oracle long enough to know it's not the white fluffy thing outside. But for our healthcare folks out here, explain the cloud and why cybersecurity and why it's important to what we're doing in healthcare.
Okay. So, why the cloud, right? Why all of a sudden it's gotten so fashionable? Well, because you see, the same lesson I learned at Oracle when Larry and I did that first transformation way back in the turn of the century, actually. Right then, what we realized is when we brought all our disparate businesses together, we removed duplication and we benefited from economies of scale. Okay, well, you know what the cloud is? You not only benefit from our scale when you come to us, the economies with Oracle, but the economies of scale of all our customers. I would challenge you to ask some of your technical people, what is the utilization of your data center? I can tell you, when we asked that exact question at Oracle, the first time we asked it, it was actually in the single digits, because the secret of tech people is they love having extra capacity just in case, right? Now, of course, you're paying for all that extra capacity. What's wonderful about the cloud is the cloud has extra capacity, but you only pay for what you use. It reminds me of someone in a completely different industry. I was talking to the CEO of Uber, and they were basically on-premise. They're a tech company themselves, right? And they were running, and remember, there was a time, I guess it was during COVID and during other parts, where you didn't even have to be profitable, and you still had an enormous market cap, not even profitable. And all of a sudden, as do all good things, it came to an end. And they felt incredible pressure to save money. And they benchmarked us against our competitors. And they brought the bulk of their workload to us and all their new workload to us. And I can tell you, when I saw Dara talking on CNBC on their first profitable quarter, I just am listening to him on CNBC, and just a little smile came to my face, because I knew that they had saved an absolute fortune by just participating in the economies of scale. But I'll tell you one other thing that he said, and I think it is one of the things that makes us a bit different, is that he said to me, and I think this is the best thing anyone has ever said, we partnered with him and with the company so closely that he couldn't tell where they ended, his staff ended, and our staff started. And it sort of brings me back to our whole feeling of being in healthcare, because I think one of the most important things Larry said about our move to healthcare was, we are doing this after decades, after building every single piece of the technical platform that's necessary. We are doing this like we did during COVID because we could, but we can't do it alone. That it has to be in partnership. in the ecosystem, in the partnership with the other technology and other medical companies, but even more so, in partnership with our customers. That's where we really shine and we learn.
So in the time that I've been at Oracle, I've heard you talk a lot about customer service. And this morning we talked about the brand new Oracle EHR. And so I know there's a lot of questions from our customers, and sometimes it can be intimidating to think about a new EHR and an implementation. Share with the audience sort of your view and what they can expect from Oracle and kind of what you ask your team to do.
Well, one of the things we learned during COVID, but even during this process since we merged with Cerner and really started to learn from our customers, is we realized that so much of what EHR had turned into was basically a giant documenting system, billing and documenting, and that physicians, physician assistants, nurses, instead of getting to do what they love, which is helping patients and learning and thinking about how do I help these patients who are in distress? How do I view their situation? They end up spending all their time typing, billing, and even in days where they spend as much of the day as they can with patients, they end up spending their nights doing paperwork or typing. And we realize that we have to turn this entirely around. Instead of putting data into the systems, and I'm sure Larry will talk a little bit about the new AI EHR systems, where really the data goes in and ultimately the data in the system is used to help doctors and nurses and PAs help their patients. Instead of data in, having the data there so that they don't have to think about just the experience they've had with the one patient. Can I give you an example?
Please.
So this is a little bit of a personal example, but I'll explain. My brushes with healthcare have always been incredibly lucky. And I'll give you one of those lucky moments. All of a sudden, my optometrist looks in my eye and she says, the back of your eye is supposed to be smooth. But it isn't. It has all these bumps. Some of you physicians, especially ones who are ophthalmologists, you probably know what that's going to mean. Well, what did I have? I had a tumor, a meningioma on the entire optic nerve between my brain and my eye, and it was coming all the way through the back of my eye. What luck. Listen to this. I go to UCSF, and I end up having a doctor, by luck, who had actually had a patient with the identical thing. And because the previous patient, had done the research, he found a type of treatment that would kill this tumor completely surrounding the optic nerve, but not kill the optic nerve. Now, lucky me, I'm not blind in my eye because of that treatment. But you see, lucky me. But what about all the other patients in the country and the world who aren't that lucky? Wouldn't it have been good because no other doctor would have found this situation and that exact treatment. And it's just one of those things where we want to be able, when a doctor when the system knows the situation, to have it recommend what are the options and what are the outcomes for the different options. Because you could have just straight radiation. I had proton beam therapy at Mass General all the way across the country. Again, lucky me. But again, in each one of these cases, let's have the systems help the doctors instead of the doctors be sitting there in their pajamas every evening after dinner, putting in billing codes. That's really what we want to do. We want everyone to have the best outcomes. I'll tell you, we did this in accounting already, okay? I told you the story of how I started, right? Finance in accounting, what did they used to do? It's like they were in a car looking backwards. They would document what had happened. That's not how finance works now, not using Fusion. Finance is actually the navigator for the business, looking forward and advising. We've done it for finance. We've done it for supply chain. We've done it for HCM. We've done it in many, many industries, banking, retail, utility, basically a dozen other industries. Now, we decided, shouldn't we use that incredibly secure, incredibly fast technology? Shouldn't we use it for something a little more important, like saving lives? I think it's time. That's what we're here to do.
That's great. I was going to say, my question was for you, was what does it look like in the future? But you kind of described that, right? You talked about better outcomes. You talked about a better experience for providers, nurses, and doctors. And you've touched upon the fact that this isn't the first time to the rodeo for Oracle. You've done this transformation before. But how do you think healthcare will be different? And what is this going to look like?
Well, listen, think about all of the advances just in the past 2 years with AI, with large language models, with machine learning, all of these capabilities. We're doing things in security, which will enhance privacy. We will allow data to be shared, in some cases anonymously, in other cases so that, God forbid, Larry gets hit by a bus. When he pulls into the hospital, they'll know everything about him, even if he's never been there. And that's how it is. You will show up, they will see you, and all your data for your healthcare, and it's your data, of course, will be available for the physicians and the nurses that you choose. And they will be able to treat you holistically. They will be able to be the doctors and nurses that they went to school to be, instead of what is burning them out right now. And they will have the same tools and better tools. I find it insane that shopping is so easy and shopping is so perfectly aligned for what you want and what you need, and yet healthcare, one size fits all. You show up and you start filling in forms. Really, every time. That's not how it should work. Your health should be at least as important as your shopping journey. And that's what we're working on.
All right, well, you mentioned AI, and I know we've just, last question for you, but AI is at the core of what we're doing. And explain to the audience, how is Oracle uniquely positioned when it comes to AI and the influence that AI will have on our EHR and all of our healthcare products?
Okay. So first of all, it's almost as if I feel like we are, 45 years. We're an overnight success, 45 years in the making. Why? Because we started with data. AI is all about huge amounts of data running securely and very, very quickly. And so we have been thinking about using these large amounts of data really our whole lives, the entire company's existence. Our platform, our cloud, is so performant. I know we talked about security, but really why do all the AI startups, why did they come to our cloud? Because we run so fast. And remember how we talked a little bit about you only pay for what you use? Well, if a workload runs in 10 seconds instead of a minute, you pay 1/6. Well, that math is not lost on these folks who are running huge workloads, because the faster they run, cheaper it is for them too. So we built our cloud for that. Our database has all of the different capabilities to store that, and all the different things are built specifically to handle your AI outcomes. And then our applications, we have 100-something agents in Fusion, and today you announced basically an AI-infused EHR. That is the future. But we have it in all our other applications, whether it's accounting, whether it's HCM, whether it's supply chain. And I'll tell you, you never have to believe me. You have to just once, and I won't make you all do it, but you will notice that in our earnings announcement, I always mention that I am announcing the company's quarter a week and a couple days after the quarter ended. Now, it's very funny because our competitors are all announcing right now. They are announcing their September quarter, okay? And it's nearly the end of October. You see, that capability, it's not that we finish and do everything on the last day. It's with the AI capabilities, we know our business all the time. And isn't that what you want out of your applications? To understand what's going on all the time. So you have better information with AI to make better decisions, whether it's accounting or it's saving lives.
So final question, I know we're a little over on our time, but what are you most excited about when it comes to healthcare?
I have to tell you, for us, that COVID experience was a shock. Our goal is to never let that happen, big or small. But even in the smallest, meaning every single patient who comes in for their experience in healthcare, instead of just every once in a while you just get lucky. No, we want everyone to have it. The most advantaged to the most disadvantaged. And for us, the partnerships with many of you is the only way to get there. I had a lovely conversation with the head of Mahari, and that collaboration where they are not only in the education side, but as they teach these doctors and nurses and how to really help patients, their focus on expanding that, not just to some, but to everyone. And frankly, not only ultimately the collaborations we do around the world, so it's not only here in America, but around the world, so that everyone can have the best and everyone can benefit from the data and the learnings of around the world. And honestly, I know I sound nuts, but we want to cure cancer. And we want to cure everything. And we want to release the resources from all these hospital systems. So just like us, we could invest in R&D, which is our main mission, that all of these systems and medical institutions can invest in their main mission. If we can liberate those funds so that we can increase the the health capability around the world, we'll consider that a job pretty well done.
Well, thank you, Safra. And I'll tell you, it is an honor and a pleasure to be at Oracle, because this will be the company that transforms healthcare. So thank you.
We're doing it. Thank you.